Good day, lovely people, and welcome to today's session of our health discussions. Yes, as I indicated in our previous video, we shall be discussing some controversies or myths surrounding H. pylori infection. So, I'll be talking about four myths or controversies surrounding H. pylori infection. Yes. So, the first myth or controversy I will be talking about is the fact that people think when you have H. pylori infection, it means that you have peptic ulcer disease. Yes. So a lot of people will go to the hospital. Then when they do H. pylori test, then it is reactive. They conclude that they have peptic ulcer disease. Please, H. pylori infection is just an infection of the stomach lining by the Helicobacter pylori. That is just it. It is an infection, just like any other bacterial infection. So it doesn't mean that when you have H. pylori infection, you have peptic ulcer disease. No. H. pylori infection can actually lead to peptic ulcer disease, but it doesn't always mean that when you have H. pylori infection, you have peptic ulcer disease. Please, it is not so, unless they do endoscopy and confirm that you have the peptic ulcer disease, which we call the stomach ulcer. Yes. So the second controversy is the fact that H. pylori infection has routine drugs. So when one goes to the hospital, then they do H. pylori test and it's reactive. Every month when the person is going to collect the BP medication or some diabetic medication or any other routine or review drugs, the person will ask for peptic ulcer medications or H. pylori medications. Please, H. pylori do not have routine medications or review medications unless you are symptomatic or you have some signs and symptoms. Yes, it doesn't have routine medications. Anything that can cure can equally kill. So please don't overdose yourself with medications unless there is the need. Do not go for routine medications for H. pylori infection. It has treatment. Yes. So the next controversy I will be talking about is the fact that H. pylori infection cannot cannot affect children. People believe that H. pylori cannot affect children. I remember we came into contact with a child, I think 7 years or 8 years, then the person was diagnosed of H. pylori infection. And we were like, a child of 7 years and has H. pylori infection. Please, H. pylori infection is, as I said, it's an infection just like any other infection. So it can affect any other person. So imagine I have the H. pylori infection, then I contaminate the surface, then the child goes there, then bring it to the mouth. What happens to the child when the child get an infection? So children are not exempted from H. pylori infection. Any other person can get H. pylori infection. And then there is this also myth that H. pylori is the sole cause of peptic ulcer disease. People believe that H. pylori is the